coming to stage 1. You have an unobstructed systemic blood flow with slightly little bit pulmonary stenosis, which is an ideal situation which you require in the newborn with the single ventricle physiology. Here, you can delay a surgery for few months, might be 1 or 2 months, and then take an appropriate call. Or you have an insufficient pulmonary blood flow where the child is going to be severely cyanotic due to pulmonary stenosis or atresia. Here, you go with an emergency BT shunt. Or you have an excessive pulmonary blood flow, unobstructed pulmonary artery. Here, you try to reduce the pulmonary blood flow by doing a PA band. This is stage 1. If you have an obstructed systemic blood flow which becomes surgical emergency, you go ahead with complex neonatal surgery, which is the Norwood procedure. Here, you have an slightly stenotic pulmonary flow. This will be an ideal situation. You can delay the surgery for 1 or 2 months. This is unobstructed systemic blood flow with the balanced pulmonary blood flow. Here, you can wait for few months. Coming to the next scenario where you have an unobstructed systemic flow, but the pulmonary blood flow is more than the systemic. Here, you can see the saturation is better, but you try to reduce the pulmonary blood flow by PA band. At the cost of is the child might be slightly cyanotic, but that will give a time for future repair. You do a PA band and wait. And the third scenario is you have an unobstructed systemic flow, but the pulmonary blood flow is not at all adequate. Here you can see the pulmonary blood flow is less than the systemic flow and the lung is not perfused properly and the child is severely cyanotic. Here, you have to go and do an emergency BT shunt. You put a shunt from the systemic artery to the pulmonary artery and improve the oxygenation so the child cyanosis comes down. This is with unobstructed systemic flow. But here, you have an obstructed systemic flow. The systemic flow is not at all there, but pulmonary blood flow is there. Here, there is no forward flow. You have to go with what is called the complex neonatal surgery, that is Norwood procedure or DKS procedure. So, coming to the various stage procedure, again I am repeating, the child with a single ventricle with the systemic outflow obstruction, you do in the first stage what is called the Norwood. In the second stage, you do what is called the Glenn procedure, where you connect the superior vena cava to the right pulmonary artery, that is stage 2, and you increase the pulmonary blood flow. And stage 3 is you connect the IVC also to the pulmonary artery. So, you have a new aorta, you have the entire pulmonary circulation going into the pulmonary artery. This is the stage procedure. Stage 2 is Glenn. It is usually done at 6 months of age, where you connect the superior vena cava to the right pulmonary artery. And stage 3 is Fontaine. Usually it is done at 1 or 2 years of age, where you divert the IVC blood also in addition to SVC to the pulmonary